Hello. Hi. Okay, hi everyone. Shireen, still here, Crystal, Marcus. Guys, we're doing a talk now with Supreme Fertility, and then our last one after this would be a talk with Vainland Fertility Clinic. So, Debra, I see you there. If you give me 1 minute, I'll be with you right now. So, I'm now actually going to do a giveaway before the talk and one after the talk because Evita's talk we will be uploading later on as we did a recording for them earlier. And then, so the prize of the Delphine giveaway, it's the myoffolate, and that goes to, I don't see you here right now. Let me just see. I just want to give this one away. I have to give this one away. And that's from Delphine Pharmaceuticals. It is for Mel Heath. Mel Heath, you are the winner of the Delphine Myoffolate product giveaway. So congratulations. And then I'm going to add, we're talking about recurrent miscarriages from Supreme Fertility. So we'll just wait for it to come on. I've just accepted her. And I think she's going to go. Here we go. Hi, Debra. How are you?
Hi, Leanne. Very well, thanks. And you? It's lovely to be part of your live events again this year.
Thank you. Lovely having you as always. Love doing the talks with you. So we're going to talk about recurrent miscarriages, but before we get into that, please just give me, if you can give the listeners a little background about who Supreme Fertility is, what it is that you guys do, and where you base or how they can contact you as well, please.
100%. Well, good evening, everybody. My name's Debra Lmgley. I'm actually a pharmacist by profession, but have been involved with Supreme Fertility for about the last 3 years now. We're actually based in Pretoria, but we do service patients nationwide. So anybody can get hold of us, and they're welcome to, at any time, drop us for more information or visit our website on www.supremefertility.co.za. And what we really do is we have a totally different approach to fertility treatment. So it's a natural and non-invasive approach. So it doesn't require any needles, any blood, any discomfort, or any hormonal preparation or things like that. So we do that through DNA swabs that we take. It's a buccal swab, very quick. It takes about 5 minutes to collect some DNA from inside the patient's cheeks, and it gives us a lot of insight into how we can optimize their whole diet and lifestyle through the information that we get.
Awesome. Okay, so we're going to talk about recurrent miscarriages and why I thought it's an important topic because just an example, I put a post up earlier on my story and I asked people to comment on how long you were struggling. And I had so many comments of women saying, I've been struggling for so many years and I've had so many miscarriages. And it's almost like, people don't talk about it. And but it's a form of infertility, recurrent miscarriages. And they just go back and try, but not actually. A lot of women actually see that you have the miscarriage, but no one actually does the proper checks to see why you are having the miscarriages and how can we prevent it going forward. So with that said, the first question is, we know that there's a 32.5% success rate with IVF procedure. What are some of the reasons for failed IVF cycles?
Okay, it's actually a lot more common than people think. So even though when they save all their money and put it into all these IVF procedures, it's only successful in about 32% of the time. And there's a lot of different reasons, and like miscarriages, there's lots of different things that can affect it. But firstly, we're looking at the egg quality, we're looking at the sperm quality, poor ovarian response, implantation dysfunctions that can go wrong in the womb, the age of women. Is probably another very important one, as well as the embryo quality. Once the egg and sperm are fused, the actual quality of the embryo has a role to play there as well. So there are a lot of different factors, and some that people don't even know about that could be the reason.
Okay, and then you mentioned egg quality. Can you explain this in more detail, please?
Yeah, well, absolutely. Well, firstly, it's very important that you've got good egg quality and egg quantity to be able to fall pregnant and conceive. That most people that have been struggling know about. And the number of those eggs drastically declines with age. Round about when the woman gets around about the age of 45, 50, there can be virtually no eggs left as well. But it's not only the quantity of the eggs that are so important, it's the quality of the eggs. And what we really mean by the quality of the eggs, can it actually become a viable pregnancy when that egg has been fertilized? And this actually only happens 30% of the time. So often women have these little miscarriages, and often they don't even know that they have actually been pregnant at all in the process. So what is really important to understand is that often it's not the problem actually the conception that's taking place, but it's everything that can go wrong afterwards. So from when that egg and that sperm actually fuse together, those cells start dividing immediately, and this requires an enormous amount of energy that is produced in the mitochondrial cells. And there are so many different factors that can influence the functioning of those mitochondrial cells. And at any various stage in the process, if any one of those little cell division stages can be interfered in, the quality of the embryo that is going to happen at the end of the day is going to be affected. So what people don't actually know, to be able to, for that embryo to become a viable pregnancy, there are a lot of important things that have to take place. And firstly, we've got to have an egg and a sperm that has exactly the right number and copies of each chromosome. So what usually happens, if you're looking at your older woman, around about 40 years of old, just on average, when they ovulate in a month, about more than 50% of their eggs could be chromosomally abnormal. And there are various reasons for that. Age is one of them, but there's a lot of other factors that can influence that as well. And it's not only in the older woman that people don't realize. So even in your younger woman, those younger than 35, about 1 in 4 eggs could have some kind of chromosomal abnormality as well. So on any particular month, you could ovulate that one egg that has some kind of chromosomal abnormality, and then the little embryo that forms is going to have a chromosomal abnormality. So even if you are taking a lot of your savings and you're putting it into having an IVF procedure done, if they are going to be retrieving eggs and sperm that have some kind of chromosomal abnormality, the little embryo that's going to result is going to be chromosomally abnormal, and that can definitely result in a miscarriage. So there are a lot of research papers and things. If anybody's interested, I can put them in touch with those things as well. But this, what we call abnormal karyotyping, so it's problems with the DNA of the egg and the sperm, is one of the most common causes or reasons for these recurrent miscarriages that happens. And interestingly enough, that they actually did a study, I think it was on about 482 Japanese women that were having recurrent miscarriages. And what they discovered in this little study that they did was about 41% of these recurrent miscarriages, the woman had this abnormal karyotyping in their little embryos. So this can actually cause more miscarriages than all other causes combined. So it's quite a common factor. But what is also very important to understand is that your egg and your sperm you're not born with these abnormally egg and sperm. So it does take about 90 days for eggs to reach full maturity and about 72 days for the sperm. Now, in that time period, you have got to keep your diet and lifestyle completely clean, because there are factors in your diet and lifestyle that can cause this damage, or that can affect the functioning of the mitochondrial cells, so there's not enough energy for this sufficient cell division and stuff to take place. So optimizing these conditions is very, very important. That's why at Supreme Fertility as well, anybody that decides to undertake our program, they've got to commit for at least 3 to 6 months, because it doesn't help. Most people change their diet or their lifestyle, or they'll use supplements very energetically for about 2 or 3 weeks, and then they fizzle out. And they could go to a party or a wedding, and the egg or the sperm could be damaged right before the woman ovulates. And that's what most people don't know either. Okay, so that's pretty much it. A little bit about, I've been speaking quite a lot there about the reasons and the quality of the eggs.
Okay, so what about the sperm? What type of factors can affect sperm health?
Okay, that's a very good question as well. So it's pretty much a lot of the same factors that can address the egg quality could be affecting the egg quality as well. So to be able to conceive, most people always look at the woman and they want to blame everything on the woman. And the husband always says the woman must eat correctly and take supplements and all those kind of things. But they don't realize that it does take two to tango. So you've got to have healthy sperm as well. So often when you're looking at these little problems, even for miscarriages, 30% of the time you could look at little irregularities with a woman, 30% of the time with a man, and then 30% of the time with both of them. And so to be able to have healthy conception, we've got to have that good sperm shape, the good sperm count, the good sperm motility, all of those things that most people know about. But what men don't realize is that it's just as important for them to take a look at their diets and lifestyles and clean it all up, because they're exposed to so many factors on a daily basis that they might not even be aware of. They could be using medications, they could be working in an environment where they're exposed to pesticides and chemicals, smoking, cigarettes, even obesity, and all these various factors have a role to play on good sperm quality as well. So both of them. That's why we say this whole process of having a baby, it's for both of them. It's for the whole couple. They've got to undertake this whole journey together and work towards cleaning up the whole diet and lifestyle at the same time.
Okay, perfect. And then Supreme Fertility has introduced a new approach to reducing miscarriages and increasing IVF success rate. That is natural and non-invasive. How does it work?
Yeah, basically, as I mentioned, we do take those DNA swabs from inside the cheeks. No pain or anything like that. And it takes about 3 to 4 weeks for us to get this comprehensive and detailed report on both the husband and the wife's genetic makeup. And the process that we follow when we start the natural fertility treatment is based on what we call epigenetics. And this is now like the forefront of modern medicine. And a very easy way to understand this, or I'm not sure what great movies on the cinema. One that comes to mind is the latest James Bond movie that I saw in the cinema. Now, if you take a script of a James Bond movie, the words are printed, they're written there, and it depends on what actor that they're casting to play the role or what director that they've got, that the outcome of the movie can be completely different. And this is exactly the same. So the script doesn't change, or the DNA that you're born with is never going to change, because that's the DNA that you have for the rest of your life. But depending where you put that DNA and what you're exposing it to in terms of what we call your epigenetic environment, so your diet, your lifestyle, drugs and supplements that you might be using, etc., the outcome in your whole fertile environment could be very different to somebody else's that has the same genetic variants or things like that as well. So this is quite exciting. It's really opened up this whole new field of personalized medicine, because by really taking a look at your genetic makeup, we can see where your genetic weaknesses lie, and we can really try and assist you as much as possible through dietary and lifestyle and supplementation recommendations and things like that as well. And I know they're really difficult changes to make, because to change your diet and lifestyle is not easy. And what I find, when you can actually explain and you can take a look at someone's genetic makeup and you can show them where their weaknesses lie and why it's so important for them, more so than somebody else, it can help them to implement it and to understand it a lot better. And it can also explain why two people might be following exactly the same program or eating the same amount of junk food or whatever it might be, and one can have absolutely no problem, they fall pregnant, like 1, 2, 3, and somebody else is having these like recurrent miscarriages and things all the time. So these genetic biomarkers, what they really do is they indicate for us certain measurements and things that we could track or look at, or potentially some biomarkers that we might have not considered testing. So certain nutritional deficiencies or things like that, just to help optimize this whole reproductive health. So what this epigenetic environment does through the diet and lifestyle, it really switches your genes on and off like a light switch. So sometimes certain things need to be working effectively and they need to be switched on, and at other times they should be off. And where you are placing yourself and what you're exposing yourself to can really affect this in a big way. They've looked at studies on twins as well, where they are genetically identical, and being genetically identical they should be at risk for exactly the same kind of things, but it's not so, because what the studies have shown, when they get married and they move on and their whole epigenetic environment changes, they are at risk for different kinds of things as well. So something else that we also touch on is another field called nutrigenomics, which is really the nutrients that you get from your food affects how your DNA functions, but at the same time, your DNA affects how you absorb certain nutrients and things like that from your food as well. So in a nutshell, that's a little bit what we call nutrigenomics as well. So it's very, very exciting, and it actually gives people responsibility, because you have a role to play in ensuring your optimum reproductive health. And even should you not fall pregnant and you want to go for an IVF procedure or some other assisted reproductive form, you need to make sure that the quality of the eggs and sperm that you are going to be working with are the best that they could possibly be. And you are responsible for doing that, and you need to take responsibility for that. And it's really nice to work hand in hand with somebody that can highlight those risk factors to you and explain to you what you need to do as well. Pretty much. I don't know if you've got any more questions for me, but that's pretty much what we do there.
The last thing we want to talk about is you got Supreme Fertility has you recently launched a new baby planner. So tell me about this baby planner, please.
We did. The reason that all came into being was I was working with a lot of doctors and patients, and the patients would also go and see the doctors quite often. And we'd recommend all these dietary and lifestyle changes and things to go. And we were just not getting a lot of, or as many pregnancies and things as we were hoping for. And what I actually realized is when you explain to somebody, I assume that they know what to do and what's healthy and what's not and what they should be. And they say they know, but they don't always know. And when they go back to their gynaes and to their doctors, how do you know when you're working with a diet and lifestyle approach, how do you know where they're stepping off the mark and what are they doing right and what are they doing incorrectly? So that was the reasoning behind this planner. If I can pretty much just show you, I don't know if you'll get a great look there, but it looks like that. I can go through a couple of these pages. So what is the reasoning of this planner is we've taken all those critical key areas that the patients need to focus on, from their diet, lifestyle, drugs and supplements, what can affect sperm health, egg quality, all these various factors. We've sort of put it into a homework manual for the patients to actually use and to fill in on a daily basis. So it's really giving them responsibility. So if they are struggling and nothing's really working, they can take this journal or this planner that they're filling in back to their gynae or the dietitian or the doctor that they're working with, and they can actually flick through it and say, oh, but you're under so much stress, or you're not sleeping well, or you're way over exercising, and it just helps to sort of pinpoint a few flag or marker areas that we should be concerned about. So in the past, it's very difficult to monitor diet and lifestyle changes because everybody eats differently. So how do you actually put your finger on where the problems are? So that's just the reasoning behind the planner that we've introduced.
Okay, awesome. So thank you very much for that. What I'm going to do now, first of all, do you have any words of wisdom for the women that's currently trying to conceive?
Well, firstly, what I'd say is don't give up hope. And don't underestimate the power of your body's ability to heal itself, because often you need to do the work, and people are often not willing to do what it takes. So people want to eat all the junk food and they don't want to give up the wine and they don't want to give up all the things that they love doing. And often those things that they love and that they're addicted to and attached to are often the problem factors. So don't give up hope, but be brave and be courageous and be willing to make those dietary and lifestyle changes, because they do have a remarkable impact to play on your reproductive health.
Awesome. Thank you very much. So Supreme Fertility will be giving away one of these planners, online planner. And the winner of this is Elise Ntoyi. Elise, please send us a message or pop us an email, info@fertilitysolutions.co.za, and we'll get you in contact with Debra, who will give you details to getting your prize. So Elise Ntoyi, you are the winner of this amazing prize. If anyone wants to get a hold of Debra at Supreme Fertility, Debra, can you just give us your details, please?
Absolutely. The website is www.supremefertility.co.za. and they can reach me through most of the channels through the website as well, or if they want to email me directly, they can reach me on support@supremefertility.co.za.
Thank you very much. Thank you for joining us today and always being available to do the talks with us. Have a lovely
It's
day.
absolute pleasure. Thanks so much, VM.
Thank
Have a
you.
lovely week further.
Thank you. Bye.